Hey guys, it's Laura from Front Office Rocks and welcome back to another video. You are going to start seeing sprinkled in, if you haven't already, that we're going to start putting more insurance videos on here too as Colleen and I have time. So Colleen is the insurance coach. She's our insurance guru, and she and I are making advanced insurance courses for Front Office Rocks to help your team members who maybe don't know insurance or need to learn insurance better, learn the in and outs of insurance. Well, while we were recording today, these videos, a topic came up that she and I don't see necessarily eye to eye on. Not that we don't see it eye to eye, but the way I did it in my office is different than the way she did it in her office or has done it in the past, because it really depends on the philosophy of your office, which is predeterminations. So predetermination, of course, is when we're trying to determine from the insurance company what they're going to pay or if they're going to pay for our patients. I understand the concept behind predeterminations. I also understand that sometimes it makes sense. If we're trying to see whether a patient can get an implant versus a crown, then great, file a predetermination. Or if there's something that we're not sure if it's going to be covered and maybe it's it's cosmetic or something, file a predetermination. However, I feel that a lot of offices use predeterminations as a crutch. If a patient doesn't say yes right away, then they say, oh, okay, we'll file a predetermination. If the patient's not sure, then the office goes, we'll file a predetermination. Or if the patient pushes back at all, they go to predetermination. Now, here's my thought about that. When you file pre-authorization or predetermination, if you get it back, if you ever look at the bottom of it, and doctors, if you've never done this, go pull one in your office. There's a little line at the bottom that says, this is not a guarantee of benefits. So if this is not a guarantee of benefits, this pre-authorization is not guaranteeing that they're going to pay for this treatment. It is not paid until the claim is sent in, and then they'll decide if they're going to pay it or not. The reason I'm saying that a lot of offices use this as a crutch is because they fall in the insurance driven. We need to find out if the insurance is going to cover it. We need to know what the insurance is going to cover. Well, at the end of the day, most of the treatment that the patient needs, right? I'm not talking about cosmetic or things that they can decide on, but the actual treatment they need whether the insurance is going to cover it or not. So I think that you have to be really careful. There's a fine line on doing predeterminations because they make sense, right? Because we need to find out for the patient. There's reasons behind doing them versus just doing them as a crutch. Okay. So, doctors, if you're listening to this, team members, if your office has gotten in a habit to doing more predeterminations than they are actual claims, you may have gone down the insurance driven side of things, which means you're letting insurance dictate your treatment for patients. And at the end of the day, insurance is great, but we don't work for the insurance companies. The patient needs that treatment, whether the insurance is going to pay for it or not. So be very careful that we're not using it as a crutch. At the end of the day, we're here to help our patients live a long and better life, keep their teeth for life, and that's whether the insurance is going to pay for the treatment or not. So that's my thought on this. Now, I know there are some offices, if you're an insurance coordinator and you work with a doctor who really wants to have, predeterminations filed, then okay, but maybe have them watch this video and just and kind of recognize, are we getting too far down the insurance path? The other thing I'm going to say about this is nowadays, a lot of insurance companies are doing more online. So look into that if you're not, because you might be able to get a predetermination instantly or within an hour or a certain period of time if you go onto their website versus submitting it and waiting for it to come back to you. So try to find ways to get answers faster, because at the end of the day, our patients need that treatment, whether the insurance pays for it or not. Do not use predetermination, pre-authorization as a crutch, because that bottom line says it's no guarantee they're going to pay it anyway. Be there for your patients, take care of your patients, and help them get the treatment that they need. Again, I'm Laura from Front Office Rocks. We can help you with these verbal skills. We can help you with how to talk to patients about this. That's what we do at Front Office Rocks. So make sure you check us out at Front Office Rocks or subscribe below if you have questions, thoughts, comments on this, and let's get a conversation started. Thanks, guys. It was great talking to you.